Hey everybody, welcome to video number 4, the last video for this week. And in this video, I'll be discussing how environmental conditions such as altitude and hyperbaric environments, as well as cold exposure, affect exercise performance and how the body adapts to these stressors. Now, environmental physiology examines how external conditions challenge homeostasis and whether, we're exercising in the mountains, below sea level, or in extremely cold environments, the body must make physiological adjustments to continue functioning efficiently. Now, as I'm beginning these squats here, my muscles require a constant supply of oxygen to produce ATP through aerobic metabolism. At sea level, oxygen availability is normally, sufficient to support aerobic exercise. However, exercising at higher altitudes changes the environment significantly. One of the biggest changes with increasing altitude is a decrease in atmospheric pressure. And as atmospheric pressure decreases, the partial pressure of oxygen also decreases. So even though the percentage of oxygen in the air remains about 21%, there are still fewer oxygen molecules available with each breath. Now, because less oxygen enters the bloodstream, less oxygen is then delivered to working muscles, and this reduces aerobic ATP production and often decreases endurance performance, especially during prolonged exercise. Now, one of the body's immediate responses to altitude is an increase in ventilation. So, your breathing will become faster and deeper in an attempt to bring more oxygen into the lungs. So as we're transitioning into some side lunges, and we're continuing our exercise, it's important to understand that the body can gradually adapt to altitude if enough time is provided. Now, this process is known as altitude acclimatization, and over days to weeks, the kidneys release EPO or erythropoietin, which stimulates the production of additional red blood cells. Now, increasing red blood cell production raises the blood's oxygen carrying capacity, helping improve oxygen delivery to the muscles despite the lower oxygen availability. Now, other long-term adaptations include improvement in oxygen extraction by skeletal muscles and a greater efficiency of cardiovascular and respiratory systems. Our notes also introduce the concept of hyperbaria, which is essentially the opposite environmental condition. Hyperbaric environments involve increased atmospheric pressure, such as underwater diving or hyperbaric oxygen therapy. Now, increased pressure allows for more oxygen to dissolve in the blood, changing how oxygen is transported throughout the body. Although, most exercise occurs under normal atmospheric pressure, understanding hyperbaria demonstrates how changes in pressure can significantly influence physiology. Other environmental challenges is like exercising in cold conditions. Cold exposure causes vasoconstriction, reducing blood flow to the skin in order to conserve body heat and protect core temperatures. Now, if heat loss continues to exceed heat production, the body temp will begin to fall. Most serious consequence of prolonged cold exposure is hypothermia, which occurs when core body temps drop below normal. And hypothermia, it progresses, muscle function, nerve conduction, and cognitive performance all become impaired, making continued exercise dangerous. Now, if hypothermia is suspected, treatment involves removing the individual from cold environment, replacing wet clothing with dry insulation, and gradually rewarming the body while seeking appropriate medical care. Now we're transitioning into walking recovery again. I'm sure this is getting old for y'all, but my heart rate and breathing rate will gradually return to resting levels. And although today's exercise took place indoors, environmental conditions always influence how the body responds to physical activity. So exercise physiologists must understand these physiological responses to safely exercise in a variety of climates and environments.